Today, the Greater Boston Interfaith Organization and Healthcare for All are standing together to announce an unprecedented step by consumers. For far too long, we the consumers have stood on the sidelines of cost control debate, while providers, insurers, and government have talked about how to spend our money. Can somebody say our money? Our money. In the face of dramatic and unsustainable rise in healthcare premiums, today we take our place at the table not only to participate, but to lead. This morning, we announced together that in concert with legislative work now underway by the governor and legislative leaders, as well as the work undertaken by the private sector, we are initiating a consumer-led process with a short and long-term focus. In the short term, by June 30th, we will announce clear overall limits for premium increases offered by private health insurers in Massachusetts. Among the wide range of issues to be considered and worked through during this second phase are the costs that providers face in their commitment to guarantee quality care to the most vulnerable populations while expanding primary care, even as they work with what many would argue to be less adequate reimbursement from federal and state government.
Good morning, I'm Amy Whitcomb-Slemmer. I'm the Executive Director of Healthcare for All, and Healthcare for All is the consumer advocacy organization driving to create a consumer-centered healthcare system that provides comprehensive, affordable, high-quality care for everyone, particularly the most vulnerable people of Massachusetts. And what we know right now is because of escalating healthcare costs, almost everyone is vulnerable. Families, small businesses, individuals who are trying to pay for their health care are finding it almost beyond their means, and something has to be done. We are so pleased to be joining with GBIO this morning to support their efforts and this work to identify a rate increase beyond which we will not tolerate.
The dramatic increase of premiums means employers have no money to offer raises to Massachusetts families trying to recover from a brutal recession. It means crowding out spending that is necessary for education, public health, and a whole range of other services. And it threatens the bright promise of quality, affordable health care for all citizens in our state and country. We therefore call on healthcare industry leaders to come to the table now. Somebody say now. Now. To establish fair but aggressive targets for reducing healthcare spending while protecting access and quality care for all.
I'm very grateful because I have coverage today because of mass health reform. But I'm concerned about rising costs, particularly the rate of rising costs. And so I feel strongly that I have to participate in the process as a consumer, because I don't want to lose my coverage and I don't want my peers to lose coverage. So I'm grateful for the opportunity to speak today and to be working together with GBIO and many of the stakeholders, because consumers are stakeholders too. Thank you.
I am presently helping our church select health insurance. For the last several years, our health insurance premium rates have gone up between 7 and 10%. We budgeted 8% for 2011. We got the bill in January, the increase was 17%.
Wow.
Now this means, in fact, not only increased costs for the church, but for our staff. One of our part-time staff who has a family, and we will contribute part of her premium increase, but when we're finished paying for it, when she's finished paying for it, her take-home pay is going to be $100 a month. Now that's not right. We're going to do something about it, but that's not right.